This pharmacology topic is thionamide anti-thyroid medications. First, let's review the hypothalamic pituitary thyroid axis and its negative feedback loop. As you can see in the image on the right, the hypothalamus, located in the brain, releases thyroid-releasing hormone, or TRH, which causes the pituitary gland to release thyroid-stimulating hormone, or TSH, which then causes the thyroid to release T3 and T4, our active thyroid hormones. Once there are sufficient levels of T3 and T4, they form a negative feedback loop by suppressing the release of thyroid-releasing hormone and thyroid-stimulating hormone, which decreases production and release of T3 and T4 in the thyroid gland. This delicate balance is necessary because T3 and T4 play important roles in the body. They increase cellular metabolism and are involved in a wide variety of bodily functions like temperature regulation, cardiac and nervous system functioning, and weight management. Hyperthyroidism is caused by too much thyroid hormone, which results in too much metabolism. So clients with hyperthyroidism are in a constant hypermetabolic state. The most common cause of hyperthyroidism is Graves' disease. As depicted on the right, this is an autoimmune disease where antibodies attach to TSH receptors and cause the overproduction of thyroid hormones. Like we said before, hyperthyroidism results in a hypermetabolic or overactive state. Signs and symptoms of hyperthyroidism include cardiac symptoms like tachycardia, heart palpitations, and arrhythmias. Clients are likely to have heat intolerance and sweat more often than usual, as demonstrated by the client in this image. Clients become more irritable, have tremors, and difficulty sleeping. Due to an increased metabolism, patients may have an increased appetite and unintentional weight loss. Clients may be fatigued, and they may notice that their hair thins. Exophthalmos, or protrusion of the eyes as depicted in the image, is also possible. And female clients may experience lighter than normal flow during menstruation, or they may stop menstruating altogether. A goiter, or an abnormal growth of the thyroid gland, can also be seen in many clients with hyperthyroidism. All these signs and symptoms are clinical manifestations of overactivity or stress. Two anti-thyroid medications of the thionamide class include Methimazole and Propylthiouracil, or PTU, though there are other drugs used in this disease state. PTU can be remembered by thinking prevent thyroid hormone from going up. Both Methimazole and PTU block the production of thyroid hormones T3 and T4 in the thyroid gland, as seen in the image on the right. They take about 3 to 12 weeks to control symptoms and achieve a euthyroid state. An additional mechanism of PTU is to inhibit the peripheral conversion of T4 to T3. This is helpful because T3 has a shorter half-life than T4 and therefore is removed by the body more quickly. While waiting for this euthyroid state to occur, beta blockers may be used to control symptoms like high heart rate, high blood pressure, and arrhythmias. If neither PTU or Methimazole are appropriate for use in the client, radioactive iodine can be used to destroy part of the thyroid gland, or the thyroid may be removed completely with a thyroidectomy. If a thyroidectomy is to be performed, Methimazole or PTU may be used to suppress thyroid hormones until the procedure is completed. The two rare but very serious adverse effects of both Methimazole and PTU are hepatotoxicity and agranulocytosis. Hepatotoxicity is more likely with PTU, which has been associated with fatal cases of acute liver failure, so healthcare providers typically choose Methimazole in most cases of hyperthyroidism. Both drugs may cause bone marrow suppression due to direct toxicity and an indirect immune-mediated reaction, resulting in low platelets and low white blood cells. The bone marrow suppression may be so severe that agranulocytosis, or very low neutrophil counts, puts the client at high risk of infection. Besides these two serious adverse effects, clients can monitor themselves for signs of too much medication, which would present with signs of hypothyroidism like weakness, weight gain, bradycardia, and constipation. And for signs of too little medication, which would present with signs of hyperthyroidism that we reviewed before as a hypermetabolic state. Due to the risk of agranulocytosis and the high risk for infection, clients must be taught to report signs of infection immediately, such as a fever or sore throat. Bleeding and bruising must also be reported, as these may be signs of low platelet counts due to bone marrow suppression. Yellowing of the skin or edema may be signs of hepatotoxicity. And since liver failure can quickly escalate to a life-threatening situation, these must be reported immediately. Clients should take the medication at the same time every day to keep thyroid hormone levels stable. Clients should never abruptly discontinue anti-thyroid medications because thyroid storm may develop if thyroid hormone levels are too high. Thyroid storm is a life-threatening medical emergency where clients experience tachycardia, a very high fever, delirium and psychosis, and excessive sweating due to too much thyroid hormone. Carrying medical alert identification can provide helpful information to healthcare providers if the client is in an emergency. Thyroid hormone levels are monitored to ensure the dose is appropriate. A final key client teaching point is to tell clients to inform their healthcare provider prior to becoming pregnant.